Assalamu alaikum. My name is Ismail. Matrix number KIB400719. I will be presenting a ECG. The function of ECG, electrocardiograph, records the electrical signals in your heart, and it's common and painless test used to quickly detect heart problems and monitor your health. And the importance of the ECG provides information about your heart rate and rhythm, and it shows if there is any enlargement of the heart due to a high blood pressure. And the ECG produced electrocardiograph is the process of producing electrocardiogram. It is a graph of voltage, various time of the electrical activity of the heart. Electric current travels through cardiac tissue towards the surface of the skin and detect using electrodes placed on the skin. And the ECG formation, there are three main components of the ECG, the B wave and QRS complex, and the T wave and U wave. The B wave represent arterial depolarization, and the complex of and the QRS complex represent verticular depolarization, and the T wave represents ventricular repolarization, and the U wave represent papillary muscles repolarization. And ECG frequency and the frequency range. ECG record the signal bandwidth from 0.0 or 0.5 Hz to 100 or 150 Hz. Frequency-based features and frequency spectrum of individual QRS complex is found in the range of 0 to 20 Hz, and the amplitude range amplitude duration less than or equal to 0.12 seconds, and the amplitude greater than 0.5 millivolt 1 standard lead, and greater than 1 millivolt 1 practical lead, and upper limit of normal amplitude is 2.5 to 3 millivolt. Amplitude decreased as the frequency increased. Measurement of ECG. The ECG measured by placing a series of electrodes in the patient's skin, so it is known as surface ECG. The wave of electrical depolarization spread from the artery down through IVS and the ventriculus, so the direction of the depolarization is usually from the superior to the inferior aspect of the heart. And here is the electrocardiograph device setup. As we can see here, this is the device and the whole cables, and here the block diagram for how it works. And here, as we can see, this is the circuit diagram of the device. And here, this is the first ECG. It was Sir Edward Schaffer of the University of Edinburgh was first to buy string and electrocardiograph for the clinical use in 1908, and the first it was presented in 1909 by Dr. Alfred to the US. The modern one ECG is much faster than Ethroven ECG and more accurate than Waller's ECG. It is, however, still relatively convenient, and the modern ECG registers differences in electrical potential generated by the heart. And here, this is the future one. The future it might make a centralized ECG machine connected to a group of patients via network in order to increase the efficiency of monitoring the healthcare providers. And here, the last one, it might be a small device with a phone app. That's all from me. Thank you.